Chapter 4: Finding and Treating the Sick. Scientists around the world took action. They developed tests for COVID-19 and began working on vaccines. The tests would show if someone was positive, meaning they had the virus and could spread it. The first tests were done in China in January 2020. As the virus spread around the world, the demand for tests increased. Some people had to wait in lines for several hours to get a test, but doctors agreed that doing even more testing was important to control the virus. Health experts also stressed the need to learn who an infected person had been near while they were most likely to spread the virus. This is called contact tracing. The idea is to get these other people tested as soon as possible and to have them stay at home until they learn if they are positive for COVID-19. Contact tracing helps keep infected and possibly infected people away from others. Some countries had success with contact tracing, such as Germany and South Korea. Their efforts helped them contain the virus when the pandemic first began. From the start of the pandemic, many of the sickest COVID-19 patients had serious trouble breathing. They were often hooked up to machines called ventilators. These machines helped them breathe. But even with the ventilators and care from specially trained nurses and doctors, many people died from COVID-19. As the pandemic unfolded, doctors saw that certain people were affected by the virus more than others. In the United States and other countries, Black, Indigenous, and people of color were more likely to get COVID-19 and to die from it than white people. One CDC study found that Black and Hispanic children in the United States were 5 and 8 times more likely to need hospital care than white children. Experts had several theories about why whites and people of color had different experiences with COVID-19. In the United States, people of color were less likely to have jobs that could be completed from home. They worked at businesses considered to be essential. That meant they had to be around many people during the day, and some of those people carried the virus. Black, Indigenous people of color also often did not have access to proper medical care. The Navajo Nation in the American Southwest was particularly hard hit by the virus. Many people there are so poor that they don't even have running water in their homes. The Navajo struggled to get medical care for the sick people.